Self-Medication, Terminology of Blame and Judgment, Part 2, by alepinkandgreen.com, the 6th of July, 2025. Welcome back. Reason 3. Is it possible to have a meaningful therapeutic relationship if doctors are presenting themselves as extensions of the judiciary? Recently passed amendments in relation to abortion, 2.3, is a great example. Some women's health and trust was being put at risk by clinicians reporting them for potentially illegal abortions, and it highlights how poor we are at revisiting archaic laws. Where cannabis patients may feel judged, such as whether they are vaporizing their script, 4, as directed, or smoking it, which they may have done historically, or there may be another reason. This is a patient group that may well have an extensive history of discrimination, including conflicts with the police and judiciary, whether through legal use or not. The person you're meant to be supporting may also have been naive enough to at least expect compassion within a doctor's consultation room. It might sound harsh, but my personal feeling is that given that there will never not be a need for doctors in all areas, perhaps those who approach those they're prescribing with disdain and judgment should consider switching to a patient demographic they do like. Of course, I'm not suggesting that in health terms, smoking is the better choice. I'm just saying there are reasons people do it. And threatening patients, or using language that might make them feel under threat, doesn't seem like a very effective way to address that. Maybe something crazy like support and education. Conversely and perversely, the judicial and policing systems certainly don't seem to be reciprocating by playing medic, given that it's still reported that many of the British public still don't understand the legality changes that 2018 brought about. 5. Are the judged illicit consumers being told that they have a legal alternative they may well qualify for? This is only my opinion, of course, but there's a section entitled Treating Patients Fairly and Respecting Their Rights in the General Medical Council. Good medical guidance. 6. That judgment faced by patients is in direct defiance of, namely the right, not just to dignity, but your right to go against advice being respected. It's hard not to smirk a little at someone who's judging your ethics, whilst apparently being hazy over their own. A fine parallel would be that of 2 US politicians, supremely responsible for the war on drugs, which would lead to prohibition here. One ended up in prison, 7, for himself breaking the law, later admitting publicly the malicious origins of drug laws, 8. The other avoided it because he was president, but he would instead publicly admit, during a televised interview with David Frost, 9, that he genuinely didn't see it as law-breaking because he was president. See what I'm saying about double standards? Reason 4. An overstretched NHS is struggling to offer GP appointments, 10, and waiting lists remain long for many assessments and treatments, 11. Although this has become a greater issue in more recent years, surely it's particularly harsh to criticize people for trying to self-treat, for good or bad, when you're not providing the service designed to support, advise, and reassure them. Oh, and treat them, actually. Are you recommending they remain in mental or physical pain or anguish in the meantime, potentially getting worse through inaction? It's another example of working with what you've got. I see little sense in early intervention medical scans unless you're equipped to provide the treatment you advise is needed. Otherwise, it's an identified problem and source of anxiety you can't control or solve. Helpful. We're told by the government this is changing, but recruitment doesn't wave a magic wand, and we're yet to see. Reason 5. Do we really view personal autonomy as an infringement? Do we forfeit our right to personal choice by seeking medical advice? The assisted death debate for terminally ill patients, now headed for the House of Lords for another reading 12. A plea for autonomy in death at least. I myself support its passing, and it's the furthest such a bill has got. I recognize some of the arguments and misgivings, but given I've written this article about autonomy over one's living body, It appears to me that the argument that withholding it in death is primarily to protect the vulnerable doesn't ring true somehow. Surely less contentious that people who are suffering should not have their decisions made solely by people who can't comprehend what they have and continue to be experiencing. I know at least 2 people who have been offered medication recently without explanation as to why it's thought they need it. How is genuine informed consent even achievable without this? Clue: if you're not informed, it isn't. Conclusion: whether clinicians or professionals are legally or ethically entitled to approach patient care a certain way, their choices will inevitably impact their relationship with patients, including trust. Existing trust issues from historical abuse or mistreatment could be made infinitely worse. I'd argue that whatever name you give this, it wouldn't be care. I remember points during my nurse training, one being hearing the word holistic in relation to care, and my enthusiasm that patients should be looked at in their entirety in the view of our healthcare model. We were even taught Abraham Maslow's hierarchy of needs, 13, in recognition of the multiplicity of needs, health being just one. A person requires met in order to function and thrive. It's worth a read to see the clear inspiration in the original intent or purpose when the British welfare state, 14, and National Health Service was created soon after its publication. Sadly, the second memory was the stomach-churning realization not long after the first that the system might think that's what it's providing. Some individuals certainly try, but in my view, they're kidding themselves by this point. What's being offered has changed, as has the doctor-patient dynamic. Many or most people seeing a different doctor each time, except in private settings, can't not impact the trust within relationships. A third recollection was perhaps a couple of years after I developed my neuro condition and had become very physically disabled, and therefore unfortunately dependent on state assistance, both financial and personal, having previously worked for decades, so independent, and gladly so. But the more services I began to need, the more I became aware that systemic therapeutic barriers I've discussed in this article apply in almost exactly the same way. Unsurprisingly, they're similar models, in terms of their brokenness actually making them a liability, harmful to well-being and quality of life, rather than the supportive provisions they profess to be. If you want your people to get better and behave better, hard when the rules are so convoluted, admittedly, treat them better. We're allowed to make bad choices. Indeed, we're sold them. Choosing things because they taste good or feel good is hardly the worst thing anyone could be doing, much as you'd think it was. Do governments and their agencies genuinely have the right to hold citizens to such higher standards than themselves? Moral right or not, is impossible, surely, to see this inequality as therapeutic. If someone is vaporizing cannabis illicitly to try and improve their lung health, is it honestly not relevant that they've been placed in public housing covered with mold? What if someone reliant on a wheelchair like I am becomes severely depressed and self-treats in some way, primarily because the roads and pavements are so neglected they can't physically go anywhere? I worked in accident and emergency for a time. I can entirely see how the time waster trope comes about, but it's hardly fair to blame attendees because you are short-staffed and knackered and stressed. That person may not have deciphered the algorithms of where they are meant to go instead. And additionally, given the potential fear induced by an adverse health event, let's try more listening and less telling for a change. Thank you for taking the time to listen to this article from ElevenReader.com. I hope you have found it interesting and thought-provoking. References can be found in the written edition on the website. Please check out the other audio versions of my articles on my YouTube channel or visit my website, ElevenReader.com.